Hi, Dr. Honig here to talk to you about a very important topic concerning how you go about choosing an orthodontist for your child. Before we do that, though, I think there's some very important misconceptions that are out there that need to be dispelled. And let's start with number one misconception being the thought that you're buying braces for your child. And since they all look the same, it doesn't really matter who you get them from. Braces are not a commodity like a refrigerator or a computer that you'd buy at the store. So that idea really needs to be thrown out the window. Number two, very common misconception is that you need to wait for all the baby teeth to be lost before a child is to be seen by an orthodontist. And that is not at all the case. And the third misconception is that you need to wait for your dentist to tell you when to seek an orthodontic consultation and to who to seek that consultation with. Let's talk about that first misconception, the thought that you're buying braces themselves for your child. When you see children with braces on, they all look the same. So the thought is, well, what difference does it make who you get them from? As long as you get braces for your child, you're doing what you're supposed to be doing for them. Well, that's not the case, in that what you're really paying for is not the braces themselves. In actuality, the actual braces are a very small part of the cost of what you're paying for. What you're really paying for is, number one, the skill and knowledge and expertise of the doctor, and of course of the staff. In addition to that, the customer service that you receive from that office. Going to an office that keeps you waiting at every appointment, that has a staff that is not friendly and often rude, is one that you wouldn't want to be spending your money on. And of course, you'd want to go to a practice and a doctor that provides your child with the absolute best care. Problem is, how do you understand what the best care is? Well, generally speaking, the best care is one that provides your child with service, with a treatment plan that makes sense to you, and that provides them with the result in a timely manner, in the most efficient and least invasive way. Let's talk about the second misconception, the need to wait for all the baby teeth to be lost before you should see an orthodontist. In actuality, the American Association of Orthodontists recommends that children be seen by age 7. The reason for this is that oftentimes when we see children prior to their need for full braces, we can greatly reduce the need for braces and the complexity of treatment. So allowing a child to be seen in what we call the mixed dentition, which is when there's a combination of permanent and baby teeth, allows us to do things that allow the baby teeth to come out appropriately and allow the permanent teeth to develop in the best possible way. The third misconception that parents often have is that there's a need to wait for the dentist to tell you when to go to see an orthodontist for a consultation and to who to go see. So why is this a misconception? There are many great dentists in our area, many of them extremely knowledgeable about all areas of dentistry, including orthodontics. The problem is, you don't really know if the particular dentist you go to is that informed about orthodontic treatment and being able to let you know the proper timing and the best person for you to seek for your child's care. There are some dentists that actually provide orthodontics for their patients and don't recommend seeking a specialist's care. While you may choose to do that, you should also have the option of seeing a specialist for your child who only does orthodontics and is properly trained. And if your dentist only recommends one orthodontist, that may be a perfectly good choice. However, you may be missing out on some other options that may be a better choice and a better fit for you and your child. As a matter of fact, one of the things that we do in our practice to encourage parents to come for a second opinion is that we do not charge for the consultation, so that there's no barrier for you to come to seek our opinion. So we've learned about some very important misconceptions concerning orthodontic treatment for your child. I hope they were valuable to you, and thanks for visiting.